I think just in the interest of time, we might make a start and we'll let everyone come in as they are ready. So welcome everyone to our webinar. It's been a long time coming. We've thought about doing this and introducing you all to a few of our team members and give you some insights into what we do at the Verve Weight Loss and Lifestyle Clinic. And the topic today is weight loss secrets. But let's be honest, they're not secrets and we don't want them to be secrets. We want everyone to know what actually works, what's evidence-based, so we can all optimize our health together. So for those of you who haven't met me, I'm Dr. Shikha. I am one of the practice principals at Verve Family Doctors, and I'm also a GP with a special interest in lifestyle medicine and weight loss as well. And I'm joined today by a few of our colleagues. So I've got Dr. Don, Dr. Keshinie, and our dietitian, Stefania Basso from Nutrition Solutions Victoria, who provide dietetic services in-house on site at Verve. So I'd just like to start with a quick acknowledgement of country. We'd like to acknowledge the traditional custodians of the lands that we're joining from today, which include the Wurundjeri Woi-wurrung people of the Kulin Nation where I'm presenting from. I pay my respects to the elders past, present and emerging, and extend that respect to all Aboriginal and Torres Strait Islander people with us today. Now, I also want to put out a bit of a trigger warning before we get started with our talk today. So this webinar will be including discussions, obviously, about weight loss, fat loss, appetite regulation, etc. And we know that these topics can be very sensitive and potentially triggering, especially for anyone who has ever struggled with their relationship with food or their body. Disordered eating is actually far more common than many people realize, and it's one of the things that in the weight loss clinic we actually do screen pretty much everyone who walks through the door for. It can affect people of all shapes, sizes, and backgrounds. So just kind of making sure all of you have a bit of an insight into that area. So if you've ever felt like you're very guilty after eating food, if you've tried to feel like you need to earn your food through exercise, felt the need to compensate for eating bad foods, felt out of control around food, or constantly worried about your body, all of these could be signs that you do have an unhealthy relationship with eating. And your mental and physical well-being, including your body image, your self-worth, and food freedom, they always come first before we talk about anything to do with weight loss. So if anything that we covered today starts to feel uncomfortable or upsetting to you, please know that it's okay to step away at any time. And if you have any concerns at all, I encourage you to speak with your GP or any other trusted health professional that you have. This webinar may not be the right space for you at this time, and we fully support you prioritizing your well-being in any way you need to. So with that, I will pass on to our first speaker for today. We're going to try and keep it pretty short and snappy today. We're covering a lot, but we're going to try and aim for just 10 minutes per speaker, and there's 4 of us. So we'll try and wrap it up in about an hour. We will have some question and answer time at the end. So if you do think of some questions along the way, please feel free to put them in the chat box. And with that, I will pass it on to Stefania Basso from Nutrition Solutions Victoria.
Awesome. Thank you. Thanks, Shikha. And hi, everyone. So yeah, as Shikha introduced, my name is Stefania. I've been a dietitian for approximately 4 years and have always had, I suppose, a special interest in weight management from doing it through medications, bariatric surgery, and also just through diet and lifestyle. So as Shikha mentioned, this is quite a broad topic. So I do want to flag at the start that this is more, yeah, absolutely general recommendations and information. Obviously, we're all a little bit different in what we need. So when I was first asked, or when we were putting this together, my topic was I suppose the topic that came to mind was what is the best diet for weight loss? So as I've debunked right at the start here, there is no one approach for everybody. Through research, when different dietary approaches have been pitted against one another, as you can see, they all work in the way of weight loss, but no diet is, quote unquote, better than the other one or produced better results. The way that they work at the end of the day is producing a calorie deficit. So, and I'll explain that in a little moment. So the truth as to what diet is best for weight loss is the one that you can stick to. So it's creating a sustainable calorie deficit. And with the calorie deficit, what I mean by that, sorry, I should have mentioned, is eating fewer calories than what your body uses. And that second sentence there is that we do try and find a calorie deficit without extreme restriction. And one thing that I tend to always mention to my clients is that successful weight loss or fat loss comes from consistency, not
I don't know.
perfection. Beautiful. So next slide, please, Shika. Awesome. So the reason why not one diet works for all, and I'm sure this is not lost on anyone, is that your individual needs are yours alone. So your energy needs and what a sustainable calorie deficit will look like for you will absolutely be different to the next person. And your energy needs depend on a lot of variables. So I've listed a few there. So one being age, muscle mass, your physical activity levels, medical history, medications that you may be taking, and also your hormonal health. So just a little bit of an insight as to how dietitians can help. So during our initial consultations, we spend a lot of time understanding, your day-to-day life, if there are any challenges and barriers we need to work with, obviously your medical history, your preferences, and your health needs as well. We can also work with you to, help you understand what a realistic calorie deficit looks like, and at the same time ensure that you are getting all the nutrients that you need. And specifically there, I've noted nutrient adequacy and to help preserve muscle mass. So I know protein is a little bit of a hot topic at the moment, so I thought I'd focus a little bit on that as well. So if we go over to the next slide, we can start that conversation. Beautiful. So this is me personally, when I talk to clients, I have tried to change my terminology away from weight loss to focus a little bit more on fat loss. So just a little pre-information. So our total body weight or body composition is made up of 4 compartments. So one being our fat mass, our fat-free mass, which includes a combination of our muscle, bone, and organs, fluid, so body water, and our bone mineral content. When we talk about weight loss, we don't necessarily want to lose weight from our muscle mass. Our goal is to preserve muscle mass while focusing on fat loss. So I think reframing that has really helped my clients sort of approach diet differently. And I'm hoping that, it may also help you as well and give you a bit of an idea of dietitians and doctors as well. I'm sure it'll come up in conversation again while preserving muscle is important. I'll just mention it. So preserving muscle mass, it is important because it's a metabolically active tissue. So we know if we preserve our muscle mass and subsequently, if we can increase it either at the same time as experiencing fat loss or at a later stage, it can help with long-term weight maintenance. It helps with managing blood sugar levels and obviously our physical function. So strength and mobility, which is very important, at all stages in life, but even more so as we start to age. Awesome. Thanks, Shikha. Beautiful. So with the main thing that we do to preserve muscle mass is making sure that you have enough protein, but we can still do that while achieving a calorie restriction. So another reason that there is a lot of conversation around protein is that it increases our satiety. So what that means is how full and satisfied we feel after eating. And the last one there is the thermo effect of food. So basically our bodies burn energy by digesting food. Compared to fats and carbohydrates, it is a little bit higher. So by prioritizing protein and elevating that, it can actually contribute to our metabolism as well. So working with a dietitian can help determine what your individual protein needs are, similarly to your overall energy goals. It is very dependent, again, on your age, your overall body composition, your health conditions, and again, your physical activity levels. So again, your protein goal is going to look a lot different to the next person. Next slide, please. Awesome. So Again, I know there is a lot of chat around protein and it seems to be sort of pushed in our faces, whenever we walk into the supermarket. But I always remind, my clients that it's definitely not the be all and end all. It is important, but there is importance that comes with fiber and carbohydrates. And again, from experience, a lot of conversation I have is, yeah, surrounding carbohydrates and almost, people having a fear of them. So I find part of my job is to try and relax that and to find, a place for carbohydrates in the diet. So just to touch on that briefly, the carbohydrates aren't the enemy, but the quality and the quantity matter. So whole and minimally processed carbohydrates such as fruit, veggies, legumes, whole grains, they can support fat loss and your fat loss goals by contributing to a strategy that we call volume eating. And that helps to promote fullness while consuming fewer calories. And that's because high fiber foods are naturally, for the most part, low in energy density. So they allow you to eat larger volumes of food while keeping the calories low. And that can be really helpful, to sort of pit that hunger without, yeah, I suppose, feeling too hungry while you're in a calorie deficit. And we also know that fiber is consistently associated with better health outcomes, including sort of a lower risk of heart disease, type 2 diabetes, and certain cancers, for example. So usually, I suppose going for a particular diet style where carbohydrates and fiber is severely limited, they can put, yeah, us at risk at some lifestyle diseases. So we do try and make sure that fiber is still elevated. Beautiful. Next slide. So this is just what I wanted to visually show everyone when I was describing calorie density. So 200 calories or 800 kilojoules, that looks like 300 grams of potatoes, which is depicted in that picture. So as you can see, that's quite a lot of volume compared to more of your, I suppose, more processed carbohydrates in the form of chocolate. So 200 kilojoules is roughly sort of six squares of Cadbury milk chocolate. So just to sort of put a bit of a visual presentation to that and how that volume eating can be really helpful with fat loss. Awesome. Next slide, Shikha. Beautiful. And just to speak to, what Shika mentioned earlier as well, food is more than just fuel, and it's a big part of our lives, and we have an emotional connection to it in one way or another. So, I know with my consultations and, most dietitians I would say, and even, doctors that have a special interest in this place take a lot of time to understand relationship with food because that is a reality that we all live in. And again, Shika mentioned guilt, and it's very much about unpacking that and repairing relationship with food and just acknowledging that, we eat for pleasure and that's okay. And that all ties into what makes a diet sustainable. We're human, we eat for pleasure, we use it, as I mentioned here, we use it for connection, comfort, celebration, even culturally. We're all in some way connected to food. So it's important to recognize that. And what we find with diets as well, that all or nothing approach and that mindset usually isn't helpful in the long term. I suppose categorizing food as good and bad and telling yourself that the diet will start on Monday can put you in that all or nothing mindset. So we will all work together to find elements of a diet, put them together, and find something that is sustainable for you. And again, just to revert back to what I mentioned earlier, it's that balance over perfection. It's what you do most of the time that's going to lead, to an outcome. Beautiful. And then my very last slide, this is a little bit sort of left of center, but I know, Dr. Don will be speaking a little bit about appetite suppressant medications or GLP-1 medications. So as they're becoming, quite common, I just wanted to throw this slide in here just to highlight some nutrition deficiencies that can pop up. The reason for this is we find with these medications on board, them obviously being an appetite suppressant, we find that overall intake is reduced. Similarly with, with variety as well. So right from the get-go, we like to flag, a few nutrients just to make sure we're being proactive about it. So we're still in the early stages of understanding, specific vitamin and mineral deficiencies. But what has come up so far is overall protein and fiber can be low, more specifically vitamins A, C, D, and E, alongside calcium, magnesium, potassium, and iron. So, what you can do about it, obviously, it seems quite obvious to eat protein-rich foods. I've mentioned a few there. So, eggs, obviously, your meat products, tofu, legumes, and dairy alternatives. But again, as dietitians, that's where we can come in and work with your preferences and make that realistic. When it comes to fiber, again, I'm sure it's not lost on anyone here, but focusing on whole grains, fruits, vegetables to make sure that you're boosting up your fiber intake. When it comes to deficiencies, this is where your GP will come into the picture to do, I suppose, a nutritional screening, nutritional blood test to help identify potentially if there's any active deficiencies, but also doing them frequently to monitor trends to see if things are going up and down, so we can basically react to them. And working with a dietitian, we can help sort of fill in those gaps through diet. But again, there will also be supplements that will come into the picture as well. So that is something I just wanted to throw in there, and I'm sure Dr. Zhang might talk about that a little bit more. Beautiful. That is all from me. So hopefully, I bet the 10-minute mark.
Perfect. I didn't even have to interrupt you, Stefania. Perfect timing.
Beautiful. Thanks, everyone.
All right, so we will hand it over then to Don. So Don, if any of you haven't met him yet, is a lovely, lovely GP. He's been working in the weight loss space for quite a while. He also works outside of Bird Family Doctors at a bariatric clinic, and he still is also quite extensively involved in bariatric surgery as well. So very much involved in this space, and I will hand it over to Don to talk a little bit about medications for weight loss.
Thanks, Shikha, for the introduction, and thank you for organizing this lovely event, and thanks for everyone for attending. So yeah, my name is Don. So if we can start the slide. So today, just gonna focus on the medical weight management side of things. First of all, I just want to get this clear. So currently the indication for weight or any sort of adult weight management medications are for BMI higher than 30 or for BMI higher than 27 with weight-related complications. Such as diabetes, ischemic heart disease, blood pressure problems, sleep apnea, polycystic ovarian syndrome, arthritis, joint pain, and fatty liver disease. So the reason we are saying that it's the case is that we're not trying to we understand that there is a big genetic variation between people's BMI, and we're not hoping to everyone to be on the same weight, but it's a spectrum of disease, and and as we know, obesity is a chronic condition, and it's a chronic disease. As a matter of fact, although it's not quite recognized as into the Australian medical system, but it is a chronic relapsing disease as well. So the reason why we want to manage the weight is not for everyone to look at BMI of 25, but want to control of the risk of metabolic disease. Next slide, please. So what we're seeing here is that the goal of any weight management, if you're looking to get your blood pressure under control, you don't have to lose 20 or 30% of your total body weight. Even 5% of the total body weight loss will see your hypertension improving, see the blood sugar getting easier to control. Up to about 10% of body weight can reduce the risk for polycystic ovarian syndrome. So you start getting your period regular, reduce the fatty liver disease, getting your blood cholesterol a bit easier controlled. Up to 15%, things like improvement, you can see cardiovascular disease improvement, sleep apnea, and joints stop aching. And if you start losing weight up to about 15% of your total body weight, then you start seeing the diabetes getting better and your heart failure getting better. So again, the benefit of weight loss and what we're trying to focus on is to find your own individual goal and work towards those, and not everyone looking like a BMI of 25. Next slide, please. So the weight management medication has come along a long time. the most common used medications in Australia at the moment, or the TGA approved treatments, are Duromine, Contrave, Wegovy, and Mounjaro. Two of them are medication tablets. Two of them are injections. They are still readily available in the pharmacies at the moment. I'll just quickly go through each individual of them and trying to give you a brief introduction. Duromine has been around for about 40 years. He, there has been a lot of people may have tried it in the past. It's fallen out of favor because of the side effects profile, including tachycardia, palpitation, increased heart rate, getting your blood pressure worse, feeling more anxious. But but it still has its place at time because its cost is a lot cheaper than lots of the injections, roughly about between $90 to $140 a month. And it's still reasonably effective in terms of the average weight loss is about 5 to 7% over 1 year. Next slide, please. So the other medication is something called Contrave. It's been around since about 2019. It's a combination of two medical compounds together, which works on the brain's reward center by reducing the appetite and also reducing or cutting out the link between eating and pleasure. It's twice a day tablet as well. The weight loss is a bit modest, and still the side effects is quite a few of them there as well. But it's actually quite useful for people who's a bit smokes a bit and drinks a bit, and that can actually have the combined effect of not only losing weight and also reducing your urge for smoking and trying to quit drinking as well. But next slide, please. However, over the last 3 to 4 years, the medication has shifted its focus from those tablets to a group of therapy called incretin therapies, or the injections. So now incretin is it's a special name for gut hormone. Under that umbrella, there's quite a few different hormones in there. So the two that we're able to target at this stage one is called GLP-1, or glucagon-like peptide 1 receptor, and the other hormone we can target is something called GIP receptor, glucose-dependent insulin-tropic polypeptide. What it does is that we now be able to mimic. So these are natural hormones produced by the body. Now we're able to produce a mimic of those hormones and produce this effect happening in the body, which is that in the brain, it reduces the appetite. And when it works on the gut, actually make things move through a lot slower. So the one that the body naturally produces lasts for about an hour. So when you eat, the body releases hormone, you feel full, but it wear away quite quickly. However, when you're on injection, it lasts for the whole week. Therefore, over the period of week, you get the effect of reducing appetite, and also you get the food stay in your system for a bit longer. And also, it does have a lot of positive benefit on glucose synthesis. That if you don't have any history of diabetes, it should not affect your blood sugar. And if you do, it will actually make it control a bit better. Next page, please. However, the main side effects of this particular medication still focus on the motility of the gut. If you imagine that all of a sudden the gut slows down, the food that you eat does not transit through your body as quickly. You can feel a bit nauseated, vomiting, maybe some constipation. When you're starting to, and those are most common side effects. When you're starting to lose weight, you can feel a bit headache, tired, feel a bit dizzy as well. You can also, less commonly, but it can also increase the reflux because things moving through a bit slowly, and have some funny sensation in the mouth. And rarely, less than 1 or up to 1 in 100, it can cause increased risk for gallstone formation, inflammation of the pancreas, and then even more rarely that it's what we call contraindicated. So if you have a history of very rare type of thyroid cancer, you should not be on this class of medication. Next slide, please. Although, just have to say on the side effects, there has been a lot of media public about the side effect of the medications. Although the medication has been out in the market for less than 3 to 4 years, but we've been using this class of medication for more than 10 years now. and there isn't a lot that we don't already know. So most of the side effect that we actually know, and if you manage it well, then it's actually quite easy to manage or easy to deal with. And also that both of the medication have had trial data up to about 4 years now, showing that they're actually quite safe to use up to 4 years. So the two main players in the Australian market is one is something called Wegovy, which is a semaglutide, only targets on one receptor, which is a GLP-1 receptor. On the clinical trial, people who are on the medication with a reduced calorie diet over a year, the average weight loss upon the highest dose, which is the 2.4 milligram, of roughly about $460 a month. The average weight loss is about 15%. But more importantly, 86% of patients or participants in the trial has lost at least 5% of weight. If you remember the medications that most we expect people to lose about 7%. So this is quite significantly better than the tablets. Next slide, please. And also this other medication called tirzepatide, which is a dual receptor agonist, which targets not only GLP-1, but also GIP receptor. On the clinical trial, it does show slightly improved weight loss outcome into the lower dose on the 5 milligram. The average weight loss is about 16%, and on the highest dose, and the average weight loss can be up to about 22%. And again, up to about 91% if you're on the highest dose, loss about at least 5% of the total body weight. And both of them are weekly injections. Next slide, please. So of course, there's a lot of limitation about the medications. It is purely a hunger, mostly suppress your hunger. So make you disinterested in food, not feeling as hungry as much, but doesn't force you to choose the right food to eat. It doesn't force you to stop eating, and therefore it doesn't force a caloric restriction. So it's very important for whoever on the medication to work out a plan to starting having a calorie deficit to lose the weight. And it doesn't change the basic metabolic function. It doesn't increase the energy or burn. So you really require a lot of other lifestyle changes to reduce the calorie intake. It will start working as soon as the medication stopped. So therefore, the commitment to the treatment is very it's important to have that commitment to at least good 6 to 12 months of therapy to get the most out of the medication, because you don't put on weight overnight and therefore you don't lose weight overnight. You really need to give a good 6 to 12 months to get the benefit out of it, and therefore the cost of it as well. And unfortunately, there's no PBS coverage on them, and some private health fund may be able to get reimbursement, but it is still quite costly. Thank you.
Thank you, Don. That was a very big topic that you've just covered in about 10 minutes, so well done. All right, now I will pass on to myself. So I did give myself a bit of a brief introduction in the beginning. I'll just add to that if you haven't ever talked to me before, I love talking about lifestyle medicine, which is basically harnessing the power of nutrition, movement, sleep, psychology, all those kind of things to prevent, but also cure a lot of diseases. So that's my area of passion. And I am also a certified health coach. So I guess that's the lens that I come from today. So the topics that I'll be covering today are a little bit about movement, sleep, and circadian rhythms. If I could ask, maybe Keshinie, if you don't mind timing me, give me a buzz or something at the 10-minute mark. So what we're going to talk about firstly with exercise, it's a massive topic. We could spend the entire webinar talking just about exercise on its own, but there's two probably key things that I want to mention when it comes to movement. So if you look at this graph on the screen, it basically shows a breakdown of how the average person expends their energy for the day. So in the green section, you see a lot of your energy expenditure actually goes to your resting metabolism. So that's the energy that it takes for your heart to beat, for your kidneys to filter, your lungs to breathe, all that kind of stuff that happens without you having any input to it. And then in the blue, there's the energy it takes to actually digest food, which is something that Stefania had mentioned as well. There are certain foods that take a bit more energy to digest, so we can maximize that. But it is a small section. And then in the red, you've got actual intentional exercise that you're doing. But you can see for a lot of people, would I say most people, that the yellow section, which is your NEAT, can actually be bigger than exercise. So what is NEAT? NEAT stands for your non-exercise activity thermogenesis. And it basically means any movement that you do where you're not intentionally exercising. And what I love about it is that without kind of feeling like you're actually having to schedule in time to do the specific exercise, you can just make a few little tweaks to your daily routine. And through doing that, you can burn up to an extra 500 to 2,000 kilojoules. And they don't have to be complicated ideas. It's simple things like if you could take a call standing instead of sitting, pick the standing. If you're doing some laundry or some other house chores, put on some music and do a bit of dancing. If you have been sitting for a while, break it up with some periods of stretching and just moving around. So basically any choice that you can make that deters you from sitting for an extended period, do it. And then the other part of movement that we'll talk about is resistance exercise. So this is essentially any kind of exercise where you're building some muscles, the kind of exercise that makes you a little bit sore the next day. You know you're working your muscles. And it's so important if you're going on any kind of weight loss journey, and honestly for anyone, even for general health, but especially if you're attempting some weight loss, because of a number of reasons. So firstly, it's this phenomenon called sarcopenia. And that's basically a word that means as we age, we lose muscle. So if you're doing nothing specific to counteract it, it happens from the age of 30. So I think most of us on this webinar would be starting to already lose some muscle because of our age. So for every decade after the age of 30, you could be losing anywhere from 3 to 8% of your muscle mass. And then from age 60 onwards, that accelerates even more. So even just to counteract the effect of muscle loss from age, it is really important to do some resistance exercise. And then if we add into that an actual attempt at losing some weight, we know that whenever you lose any amount of weight, a proportion of that will always be some muscle. It's nearly impossible to lose just purely fat. So when you're attempting this weight loss, it is really important that we do things to maximize the amount of fat loss that we're getting and minimize the amount of muscle loss. And that comes down to a combination of the two things I've already mentioned, the resistance exercise and making sure you've got that protein in your diet to actually fuel those muscles. The other thing that resistance exercise is really good for is actually increasing that green section on the graph, your resting metabolic rate. Because the more muscle you have, the more energy you burn when you're just sitting and doing any of your daily activities. And if you are someone who does have what we call insulin resistance, so if you've ever been told you've got slightly high blood sugars, polycystic ovarian syndrome, pre-diabetes, or actually diagnosed diabetes, resistance exercise is absolutely essential and can be so game-changing to managing your blood sugars. Because muscle is essentially a bit of a mop for blood sugar. So if you've got extra sugar floating around in your bloodstream, your muscle is what's going to take that away from doing any harm in your body. So the government guidelines in Australia recommend doing a minimum of 20 minutes of resistance exercise at least twice a week. So if you're someone who's a little bit intimidated by it, try and aim for even half of that. Start with a 10-minute workout. It doesn't have to be anything fancy. You can go onto YouTube and find any old, body weight exercise. Start low and build it up gradually. But I'd really encourage everyone to consider your NEAT and your resistance exercise. Now, the next topic I think would have to be one of my favorite topics ever to speak about. It's honestly mind-blowing to me how important sleep is and how underrated it is as a tool for optimizing our health. Now, here in Melbourne, we actually run a bit of an experiment over the entire state twice a year with a little something we'd like to call daylight savings. And the actual things that you can measure on the days with daylight savings is coming into effect and going away is pretty astounding. So in the time when we lose an hour, for most people that ends up being that they actually lose an hour of sleep. It's not many of us tend to go to bed that extra hour early. And the day following that, heart attack rates go up by 24% in the entire state. And then we reverse the experiment. When we gain an hour, heart attack rates the next day drop by 21%. So if you ask me, those numbers are absolutely astounding. I cannot believe that, that 1 hour of sleep makes such a difference on a population level. So, I think it goes without saying when you hear those numbers that sleep is essential for staying alive. But also, if we're talking about weight loss, it's also really important. So sleep research is actually really interesting, at least to a nerd like me. They often do it by putting people in these very controlled little environments called sleep labs, where they can control how much sleep people are getting and keep lots of other things stable. So we know it is the sleep that is the effects that we're measuring. So there was one where they put two groups of people into the sleep lab. One group was only allowed to sleep for 5.5 hours every night, and the other half were given a luxurious 8.5 hours sleep, and they continued that for 2 weeks. And then they gave everyone the exact same diet. It was calorie controlled, so everyone did actually get some weight loss because of the calorie deficit, because that is kind of the key thing to achieving some weight loss. But what they found was that the people who were sleeping only 5.5 hours every night, what they were losing was mostly muscle mass, versus the people who were sleeping 8.5 hours every night, they were losing mostly fat mass. So even though you might be losing weight, if your sleep is not on track, it could well be that you're actually losing more muscle than the fat that you want to be losing. The other thing that they measured in some of these studies where they're controlling sleep is that the hunger hormone levels are going up. So they can measure that. It's a hormone called ghrelin that we like to talk about, and it goes up measurably in these studies. And the effect of that is that you end up consuming significantly more calories. So again, to quote it, they were comparing some people who slept 8.5 hours a night compared to just 2 hours less, so 6.5 hours, which I think a lot of us, at times would get only the 6.5 hours at night. And for the average person, they'd end up eating 270 calories more just by changing that 2 hours less of sleep. And that's the equivalent of like 3 slices of bread. So, if you know that sleeping a little bit extra could make you automatically eat a little bit less because you're feeling less hungry, and also know that it could reduce your chance of a heart attack, I think it sounds like a pretty win-win situation. Now, if you are hearing this going, that's great, but I suffer from insomnia. I'd love to sleep a bit better, but it is just not that easy to do. We get it. And insomnia is a really, really big problem in our society at the moment. We see it all the time as GPs. And the best therapy that we really have for insomnia management now, firstly, is to start with your sleep hygiene. So you can, Google sleep hygiene and get list upon list of things that you should be doing before sleeping, things you shouldn't be doing. But to take it to the next level, there's something called CBTI, which is cognitive behavioral therapy for insomnia. There are some versions you can access online as a e-learning course. There's one from This Way Up that I often like to use. But there is actually a better option where you can have this tailored for you and delivered in person. And we're actually really lucky that Dr. Keshinie is trained in CBTI, which is actually quite a rare skill for a GP. She's, I think, the only GP I know, and I know quite a few that actually do this. So I might get Keshinie to give us a little bit of a spiel on CBTI.
Thanks, Shikha, and that's 9 minutes as well. So good. So CBTI is therapy for insomnia. It looks at that connection between how you're thinking, how you're feeling, and how you're behaving around your sleep. So I offer CBTI as some structured sessions, 5 structured sessions that I recommend doing weekly or fortnightly. Each session covers a different area of sleep, and we explore what your current habits are and behaviors around sleep time and look at adjusting them. In between sessions, I give you some resources and some practical strategies to put in place before our next session. And we work together to hopefully improve your sleep quality and sleep duration. Back to you.
And I believe the sleep consults are available for booking on HotDoc. So if you're ready to see Dr. Keshinie, you can just select this, what do we call it, Keshinie? Insomnia?
I think it's sleep consult or insomnia management, I think.
It should be fairly self-explanatory when you look it up. Okay, given that we're at the 9-minute mark, I will be very, very quick with the last couple of things I have. So your circadian rhythm, I think it's been a very topical thing. Most people have heard about it, but it's basically your body's internal clock that tells you when it's morning time, when it's nighttime, and the flux in hormones that come with that. And one of the things that we know is really important for regulating your circadian rhythm is exposure to light, particularly light in the morning, because that's what tells your body to bring down its melatonin levels and to bring up your cortisol and help you to be more awake and ready for the day. Now, how this actually relates to weight loss. They've done some research into it and have found that there was one particular study I like quoting where they got people to use bright light exposure therapy, and they did this in the form of a light therapy box, of kind of a artificial light that you put in front of your face every morning. And over just 3 weeks, they found that people who were doing this every day achieved more fat loss and had a lower level of appetite compared to people who weren't using it. So it's a fairly kind of simple thing to do, and it's one of those things that I talk about in any lifestyle medicine consult, because it does have so many flow-on benefits getting that early morning light exposure. And practically what it means is just to be trying to get outdoors, ideally early in the morning, if you can, within the first hour of waking. It can be in the form of outdoor exercise if that's something like you like to do in the morning. If you'd like to have a more leisurely morning, you can take your coffee out in your patio or whatever it is. Unfortunately, being next to a window, the glass does actually block a significant amount of the light, so it does need to be actually outdoors. Even if it's overcast, the effect will still be there. But if you are someone who, particularly this time of year, it's dark when you're waking up and there's no access to morning light, you can actually buy these light therapy boxes as well. So you just want to make sure that they are a minimum of 10,000 lux. But I was having a look just before the webinar on Amazon. They're actually not too expensive if it is something you're interested in. And interestingly, a lot of the guidelines now coming out around treatment of seasonal depression. So people who find that their mood gets very significantly low this time of year when it's dark and a lot of grey days, first line therapy for that is now considered light exposure therapy as well. So if that's something you'd like to give a go to, would highly recommend it. And then finally, again, this is also a very big topic in and of itself, but to summarize it very quickly, we do have multiple studies that also show that how your body processes food varies depending on what time of day you eat it as well. And there does seem to be a metabolic and weight loss benefit to having more of your daily calories earlier in the day. And even if we're talking about blood sugars, so again, if you do have that pre-diabetes, diabetes, polycystic ovarian syndrome, any of that kind of thing, we've found that if you can eat the same food in the evening and it will spike your glucose by about 30% more than if you ate the exact same thing in the morning. So that old adage of having breakfast like a king, lunch like a prince, dinner like a pauper could actually be quite useful for some people. Obviously, this does need to be tailored. Different things work for different people's and your lifestyle. So it's not a one size fits all approach. But if you're looking for something to try, it's one approach that I do like to talk about. And that is it from me. Before I hand over to Dr. Keshinie, just a reminder that we do have an active chat box going. We will do a bit of Q&A if anyone is willing to put a question out there at the end. But otherwise, I will hand over to Dr. Keshinie, who is a colleague. She is a wonderful general practitioner who works at Verve and another clinic in Baronia as well. Also, I think just as passionate about lifestyle medicine as I am. And she's also a certified health coach. And we did our health coaching training together. So I will hand over to Dr. Keshinie.
Thanks, Shikha. So hi, I'm Keshinie, and as Shikha said, I'm another weight loss doctor at Verve. I've got a few extra qualifications. I've also got the recognition of extended skills from the RSCGP in obesity management and also SCOPE certified. I'm also an accredited lifestyle medicine doctor and very passionate about lifestyle medicine. And I'm an accredited health coach, which we'll be talking about a little bit later. So next slide, let's talk about stress. So acute or short-term stress causes a spike in hormones that signal that fight or flight response. That can be quite beneficial, so it can improve your memory, your focus, your physical performance, and your immune function. But unfortunately, these days, we're all under a lot of pressures that lead to chronic or long-term stress. So it could be something like a busy or intense job. It could be the demands of raising kids or looking after elderly or unwell family members, the rising cost of living, a combination of all of these or some other factors. And that results in prolonged or frequent episodes of stress. This can unfortunately lead to negative impacts on the body, especially due to elevations in a hormone called cortisol, and that can cause weight gain. So there are a few different ways that cortisol can lead to weight gain. It can increase your appetite, especially for those sugary or fatty foods. Cortisol stimulates that weight gain to be stored in the abdominal area. It can also increase insulin resistance. So we were talking about diabetes and PCOS, and it can increase fat storage because of the insulin resistance. And cortisol can also lead to muscle breakdown. And we've been talking about the importance of muscle for your metabolic activity and maintaining that metabolic rate. So if the muscle is breaking down, then it becomes harder to lose weight. There are also some behavioral changes that can happen due to stress. So it can affect your sleep, and Shika's just nicely told us all of the risks of having poor sleep that can be associated with weight gain. And poor sleep can also increase your risk of stress, which then in turn increases your risk of weight gain. When you're under a lot of stress, you might not have the energy to exercise, and you might be more likely to undergo some sedentary behavior. So again, that can increase your weight. The other thing is emotional eating or emotional overeating. So stress can increase your cravings for those sweet or salty foods. It can also, those foods are quite beneficial for your brain because it signals reward pathways to temporarily dampen the stress. But in the long term, it can lead to negative feelings such as guilt. And that can set you up in this cycle of emotional eating, feeling guilt, feeling negative about yourself, increasing your stress. And it can be quite difficult to break out of that cycle, especially if food has been a primary coping mechanism. Next slide. So luckily, there are quite a few management strategies that we can use for stress management. So some quick strategies like breathing exercises, meditation, mindfulness, they may only take a few minutes, but they can be quite effective to reduce those spikes in stress and cortisol. Like any strategy or any new thing that you're trying, it's really important to practice it regularly and to practice it when you're feeling calm. Once you've got the hang of it, then you can use it in times of stress, and hopefully it improves that level of stress. Regular exercise is really good. So exercise can reduce cravings for food. It also helps with your physical and mental well-being, improving your self-esteem, your mood. Exercising in nature is really good for your mental and physical well-being, but even home-based exercises can be quite effective. Studies also show consistent participation in enjoyable leisure activities can help buffer stress. So whether it's art or crafts, cooking, dancing, sport, gardening, whatever it is that brings you joy, it can have it can be beneficial for stress management and therefore weight loss. It can be hard when we're really busy to get back into those activities that we love, but it's such an important thing for your health. We also know that regular social interaction can buffer stress and improves resilience, and it actually dampens that cortisol response in relation to stress that we've talked about. Before I talk about goal setting, I also just want to mention that sometimes stress is more than stress, and it can be depression or anxiety and just going beyond that basic level. And in those situations, it is important to get some extra help from your GP or from your psychologist. So goal setting can also help reduce stress. Goals can improve your motivation and self-confidence. And the key is keeping the goals small and specific so they don't seem too daunting. A framework like the SMART framework can be helpful. So keeping your goals specific, measurable, achievable, relevant to that long-term vision of yourself, and with a time frame that can make it more achievable. So for example, instead of thinking, I want to walk more, you can set up your goal thinking, I'm going to walk for 20 minutes, 3 times a week after work, and I'm going to check back in with myself in 2 months' time. And it just makes it a little bit more concrete for you to keep yourself accountable. So I'll go to the next slide, please, Shikha. So goal setting can be difficult, especially when we're busy and have many competing priorities. At the Verve Weight Loss Clinic, we do spend quite a lot of time thinking about goal setting and helping you frame those goals using the SMART framework or something similar. We also employ the health coaching approach, which we've kind of touched on. So the traditional model of healthcare is you come and see your health professional, your dietitian, your GP, your allied health professional. You come to them with a problem, we give you a management plan, and then you go away and implement it. It can be quite useful for certain conditions, but when it comes to chronic conditions and behavioral change, it can fall short. So the health coaching approach is a bit different because it takes you as the expert of your own life. We still provide information, we provide advice, we fill in gaps in your knowledge when it comes to weight management, but we don't tell you what to change or how to change it. Instead, we explore your motivation. What makes you tick? What is it that you're working towards? What's your end goal? We use that information together to work out what's the next most important and achievable step towards working towards your long-term health journey. And we help you structure that into a concrete goal. We identify barriers that you might face in coming up with these goals and how to work around them. And in subsequent appointments, we look at what went well and what could be improved. So it's a continuous partnership looking at that long-term growth and continuous improvement. And hopefully together we can work at achieving hopefully your long-term goals in health. We are also offering these appointments of health coaching, not just for weight management, but for the prevention and management of any other chronic diseases. So if you're interested in that, I think, Shikha, do we have that set up for patients now as well?
We do indeed. So as of yesterday, we have launched our health coaching appointments. So they're to start off with at half an hour, and they're charged as a standard long appointment, so $100 out of pocket. But we have been getting a lot of value, I think, well, as GPs, we get a lot of value out of them because they're so fun to work with people and to see them making progress and actually achieving things. It's way more rewarding than, saying, here's handouts and off you go. We're just, working very, very closely with people. So yes, very excited. If anyone's feeling like that's what they need to focus on is the health coaching, you can book in with either myself or Keshinie for some specific health coaching appointments as well.
That's all I had as well for a topic.
Amazing. All right, so it's been jam-packed webinar so far. I'll leave a couple more minutes in case anyone does have some questions to ask. There seems to be stunned silence in the chat at the moment. A little bit of a spruik, I guess, for the Verve Weight Loss and Lifestyle Clinic. If you haven't come across it, if you look on the Verve Family Doctors website, we do have a tab at the top for weight loss, and you can see what happens at the clinic. But essentially, you would see one of our special interest weight loss GPs. So at the moment, it's myself, Dr. Keshinie, and Dr. Don. We do also have Dr. Monica, but she's currently on maternity leave. So our initial consult is a 1 hour jam-packed session where we go into all the nitty-gritty of your journey so far and what exactly it is that we're going to be focusing on. And all of us who are working in the weight loss clinic are scope certified, and I'm sure, as you can hear, are really, really passionate about working in this space and doing it well. We do also, if you're enrolled in the clinic, have access to some body composition scales. So all that stuff we were talking about, maintaining your muscle mass and making sure you're losing fat as we want to and maintaining all the other things, we can help to ensure that's exactly what's happening with our body composition analysis along the way. We do also have an e-learning course that we've put together. If you book with myself, that is a requirement to have done the e-learning course. We'll be working through it alongside the consultations. But essentially what we've talked about today is a little bit of a taster of what the content in the e-learning course is. It just goes a lot more in depth. And essentially through the clinic, we make a customized plan for you. We cover all things medical, check that there might be any medical things that are contributing to your weight gain or making it harder for you to lose weight. We check all the things that we need to be monitoring for as well, and also cover all the lifestyle things and work with you for goal setting. And we also work within a holistic multidisciplinary team. So we work with people like Stefania, other dietitians from Nutrition Solutions. We've got exercise physiologists, psychologists, everyone that we would possibly need. We've got our little network set up that we can link you in with. So if it's something that you think you're ready to invest in yourself and get going with, feel free to book in. If you just want to have a bit of a chat and find out if it's best for you, you're welcome to book a standard consult with any of us as well, and we can get the ball rolling. All right, let me just have a quick look in the chat. We do have a few questions. Let's have a look. So I might throw the first one over to Steph, if that's all right. So, can excess protein consumption have any negative consequences? It looks like pretty much most of the shelf-based food products now come with added protein, like yogurt, desserts, breads, cereals.
Yes, so thank you. So with excess protein intake, it is possible to have I suppose more negative outcomes with that. It may not be necessarily related to the protein itself, but what protein also comes with. So very briefly, I'm sure we're aware there's three macronutrients that exist. So all foods are either one of or a combination between protein, fat, and carbohydrates. So generally speaking, when we talk about excess protein intake, it may be related to, I suppose, the fat that comes with meat. That may have an impact, obviously, we know, on heart health and metabolic health. There is also, I suppose, eating too much protein. It's also a sign that you may be neglecting other nutrients and other micronutrients and macronutrients in the diet, and that imbalance again can lead to I suppose more adverse health outcomes. But generally speaking, it is I suppose difficult to get too much protein. If you do, I suppose, I know this is a very broad term for me to say, but if you have a balanced diet, generally we have a high threshold for protein intake. So hopefully that answers the question. And then the second one was yes, to do with added protein. So yes, that's a big that's I suppose why I wanted to briefly touch on it today, but obviously I didn't go into too much detail. So it is the trend at the moment, and it can be helpful in helping people achieve their protein goal, especially I suppose in the context of using appetite suppressant medications. So for some products, you do get a little bit more bang for your buck. But there is a lot of marketing, I suppose, to look out for as well. So one of the examples that comes up for me that I tend to show clients is yogurt. So one of the brands that I'm sure we're mostly familiar with is Chobani. So when you look at just the plain sort of Chobani, either the light or their full cream version, and compare it to the Chobani Fit, it's actually very close in protein when you compare it per serve and per 100 grams. So a lot of I suppose foods are labeled high protein, but they're either naturally high protein before. Now they're just claiming, I suppose going with the trends, or I suppose then they're pretty comparable to other foods. So important to look out for that. And also another, I suppose, will be high protein cereals, for example. It's important to look at the context. So cereals by nature are not probably the most efficient way to get protein, but comparatively to other cereals, they are high in protein. So there's a bit of nuance there as well. So again, hopefully that answered that question. And the second question there is there any risk in fasting, whether it's intermittent fasting or extended fasting? So I suppose the risk that would come with that is, I suppose, just being too much in a calorie deficit and not reaching all your, I suppose, your goals when it comes to your nutrition. But also it does have a little bit to do, I'm sure, Dr. Shikha might have a little bit more to say with this, but also sort of pairing it with your circadian rhythm. So as well. So for some people, it may not work. It may not be helpful. And one thing that I do uncover when I sort of investigate why people want to try intermittent fasting, it tends to be sort of the gold standard for, anti-aging properties. So there hasn't been sort of too much strong evidence, with that. But when it comes to, I suppose, fat loss, it is just one, I suppose, strategy to decrease calorie intake. So you're just decreasing your window of eating. That may suit people, it may not suit people. So beautiful. So that's it from me.
Amazing. Thanks, Steph. Next one I might throw over to Don. Is there any literature about Ozempic use past the 4-year mark?
So in short is no. So the trial currently, the longest running trial is about 4 years at the moment. But the long run is that, as I said, we've been using this incretin therapy for years. If you people are familiar with a brand like Byetta, even Saxenda, they've been outdating this class of this Ozempic for about sort of 4 or 5 years. So they all work on the similar method, and therefore we don't expect anything new that we don't know. And of course, like everything, there's like all the medication in the world that, even you are on a PPI, you've probably been on it for 20 years, and then now there's a scare about being linked to Alzheimer's disease. So there's a lot of things that come out to media that often get debunked. And the key thing is, if you have any concerns, just talk to one of us, and we'll all be in the field and know any info about all the medications. So yeah, so generally it's quite safe to use. And also, I have it's to comment on intermittent fasting as well. It's generally not a great idea to do when you're on medication. I often advise that to be on 3 regular meals a day rather than just extended period without any food. Because when you're on the medication, that you can forcefully make you consume quite a really, really low calorie diet, and plus fasting on top of that, then it's really gonna throw your body into a really, really negative calorie and sort of overall, and then making you really feel uncomfortable, dizzy, even some what we call hypoglycemia can happen, and it's not very nice way of working with the medication. So you actually don't need to intermittent fast when you're actually using the medication as well. So yeah.
Awesome. Another one for Steph. I'm curious about protein sources. How much red meat is okay each week?
Yeah, so there is, as I mentioned before, I suppose with protein, it is sort of synonymous with animal protein. So we think of protein as being, I suppose, your fish, chicken, red meat. So there is also protein in lots of other foods as well. So your dairy and obviously your vegetarian protein as well. So your whole grains, your beans, your lentils, tofu contains a bit of protein. So as dietitians, we can help break that down for you, calculate, how much protein you are getting. If it is, something that there is a little bit of room to move to either decrease or increase, we can work with that. When it comes to red meat, it's generally recommended to have, and look, this is very much a general general overview. So around 200 grams per week. But this is, again, very much on a population level. Everybody is, it's a little bit different. But yeah, just for general health, and I suppose to promote a variety of protein, red meat is, sort of roughly 2 times a week at around sort of 100 and 150 grams. That's what we tend to go by. Beautiful. Hopefully that, answers that question.
Next, I will hand over to our sleep expert, Keshinie. Does taking magnesium really help you sleep better?
So magnesium has been found to improve sleep. With everything, we are very lifestyle based, and people can really get sucked into supplements, and they can be quite expensive as well. So if you're having a generally balanced diet with fruits and vegetables, you're probably getting enough magnesium. But if you are finding that it is pretty hard to get to sleep, it could be worthwhile trying a short-term supplement. A lot of magnesium supplements are actually formulated with B vitamins, and we're now knowing that excess B6 vitamins can cause nerve problems. So if you are trying magnesium for sleep or for something else, just make sure on the label that there's no extra B6. So just find magnesium alone. It's my little plug for supplements.
Good. Next one, I might throw back to you, Steph. There's lots for you. What is the next step if you've started taking Mounjaro but want to look more at diet and food? And dare I say, it would be an appointment with you.
Hopefully, people get a bit out of it. But yeah, I suppose, like Verve, I suppose being a dietitian, I am, heavily involved in, a lot of GLP-1 sort of, conjunction conversations. And I tend to find that, that can be really helpful to, I suppose, uncover what is important for you, how we can sort of approach things. But hopefully you took away from today just being a little bit mindful around, investigating protein, sort of maybe doing a little bit of a mental sort of calculation to get a bit of an idea of how much protein you're you're getting, but also exploring fiber. So I saw there was a question, I might just jump ahead. So yeah, Lillian asked, I'm curious about the amount of protein to eat in regard to weight loss. So there is a little bit of variation, but very, very generally speaking, we tend to find if your BMI is sitting within 18 up to about 29, we sort of aim for anywhere around about 1.2 grams of protein per kilo of body weight. That can be a little bit more, a little bit less. If your BMI is over 30, then what we do is basically work out an adjusted body weight or sort of a goal weight and work off that. But even still, we then sort of bring protein goal up to about 1.6 grams per that adjusted body weight. So that's a general rule of thumb. Again, as mentioned earlier, there's a lot of differences there. It can go up to sort of 2.2 grams of protein per kilo of body weight, but that's sort of 1.2, 1.6 is generally where we aim for. So hopefully that answers Lillian's question. And then sort of bringing back into generally speaking, for general health, we're aiming for about 25 to 30 grams of fiber. So it's worthwhile doing a little bit of investigation there and sort of doing a little bit of mental maths to figure out how much fiber you're getting. And then, if there's any troubles, from there, we can absolutely tweak it. And then just being, again, mindful, I definitely recommend, investigating blood tests or nutritional bloods to have a look at any deficiencies that we can sort of treat in the moment, or again, just to sort of start that monitoring process while you're on the GLP-1s.
Yeah, I'll just second what Steph said, but I encourage anyone who's taking one of these GLP-1 medications, if you're investing honestly that much energy, money, etc., into these medications, seeing a dietitian is well worth your while, because it's changing the whole landscape of how you're eating. So it's absolutely essential to make sure that the reduced appetite is coming because of the medication, but we have to make sure that your nutrition is on par. So I would very strongly recommend seeing a dietitian. All right, I believe that brings us to the end of our questions and the end of our webinar. So thank you everyone for giving up a Tuesday evening. Hope you got a bit out of it. If there is any specific questions that you have, you can always email through the clinic. Otherwise, we will see you around in some consultations. All right, good night, everyone.